We're doing a series on common foot injuries, and at the top of that list is going to be plantar fasciitis. This is one that most people have heard of. They know somebody that's had it, you've had it yourself, or commonly it is misdiagnosed. This tends to be almost a catch-all diagnosis for any pain in the foot in general, but plantar fasciitis has a very specific presentation, and I want to go through that today. My name is Dr. Zach Ratliff here in Charlotte, North Carolina at TruMotion Therapy, where we specialize in the conservative management of musculoskeletal pain and injuries, which means our treatments don't involve the use of surgery, drugs, or long-term care plans. And one of the common things we treat in our office is plantar fasciitis. Let's start off by talking about what the plantar fascia is. The plantar fascia is a thick, robust tendon-like substance on the bottom of the foot. Now, that structure goes all the way from the heel or the calcaneus all the way to those metatarsal heads right before the tips of your toes. Think of this as a very thick tendon that helps add a robust layer of stability and durability to your foot. Now, in terms of presentation in plantar fasciitis cases, it is typically a very specific pain right at the corner of the heel, a little bit toward that inside edge. Now, the reason for this is a common thing that stresses that plantar fascia is an overpronation or an uncontrolled pronation. So when that arch subtly collapses, and what that does is put a subtle stress right on that spot. Now, this is a common one, but I also like to mention that there are a lot of other things that can cause pain on the bottom of the foot. So if we take that plantar fascia away and we have all these bones, you see all of these layers of muscle underneath on that foot. So there's a lot of different things going on here. So plantar fasciitis is very specific. Typically it is going to be worse in the morning. Those first couple steps as you get out of bed are going to feel like an ice pick or a knife in the bottom of your foot. As you start moving a little bit more, it gets better. But then commonly toward the end of the day, or as you've been spending a lot of time on your feet, it tends to worsen. Now, that can also be a result of weakened foot muscles. There are also some nerve issues that can happen in the feet, as well as stress fractures in the calcaneus or the heel bone itself, so right underneath that plantar fascia. It's important to get a proper diagnosis when you're experiencing pain on the bottom of the foot. So I would invite you, if you are struggling with pain in your foot that you think might be plantar fasciitis, find a provider that's well-versed in these, that treats them commonly. And so if that does sound like you, I would invite you to check out our website at TruMotionTherapy.com, where we have more resources, more information, more videos, as well as the ability to schedule an appointment with one of our providers. And we would love to take a deep dive look at what you have going on, if there might be some things kind of up the chain, whether it's in the knees or the hips, and just get you out of pain and back doing the things that you love.